Hey, it's John with NRSNG.com. So what you're really getting when you get the nursing student toolbox is you're getting the tools and the information that you need to succeed on the clinical floor. Okay, this is designed for the clinical floor. What you get with it is you get the cheat sheets printed on high gloss cardstock paper. You get 2 ID badge value cards, and then you get multiple templates and things that I used in nursing school and that I use even today on the clinical floor to help me organize my work. Then you also get this little sticker to show your pride for nursing. So let me talk about these things individually really quick. You're gonna get these 2 ID badge value cards. These are the thickness of a credit card, okay? So what I saw when I was working as a nursing student on the floor is I got some of those ID badge value cards and they were really flimsy and they just kind of broke. So I created one here that's the thickness of a credit card. It's gonna last you your entire career as a nurse, and it has all the lab values you're gonna need to know for your patients, okay? And they're also organized in alphabetical order. The reason I did that is it makes it quicker and easier for you to find when you're looking for a lab value quickly. The other lab value card you're gonna get, it's gonna be therapeutic drug levels, dosage calculations, and insulin onset and peak times. Okay, that's gonna be really handy with your different patients. They're gonna be on different medications where you're gonna have to do quick calculations, or like every patient you're gonna have who's taking insulin. The cheat sheets you're gonna get a cardiac cheat sheet. This one has hemodynamic values, Wigger's diagram, EKG placement. It also has the 10 most common EKG rhythms that you're gonna see. Again, these are hard cardstock. They're gonna last you. They're designed to fit inside your clinical clipboard. Okay, that's the purpose of this, is to bring with you to clinical, to take with you to class, and they're gonna last you a long time, okay? Then you're gonna get our pharmacology cheat sheet. It shows injection sites, so it's the 50 most common medications. It shows you disease-specific medications. So if you have a patient come in with acute renal failure, congestive heart failure, or AFib, what are the medications you need to give for that? Then we also have essential NCLEX meds by class with some of the most important considerations for that. You also are going to get this cheat sheet here. This is the one I probably like the most because it has all these lab values up here with your normal ranges, but it also shows kind of the diagrams that your physicians are going to use as they're writing out their assessments on patients. APG values, dosage calculations, again, EKG basics, and then on the back you got a lot of kind of the fundamental type stuff, the pressure ulcer staging, the cranial nerves, Glasgow coma scale, hierarchy of O2 delivery. So much going on here. And then this last one here is Mnemonics. You have Mnemonics for OB-PEDS, labs, mental health, pharmacology, and med-surg. And this is just kind of a quick one to help you just glance over and reference when you have a little bit extra time. Then you're going to get 3 different templates, okay? And with this, you're going to get 5 of each of one of these. And so let me just talk through these really quickly. First one you're going to get is going to be your handoff and assessment sheet. I had to create this after working with a lot of students and new nurses that had a really hard time organizing their mind and organizing their handoff report. Okay, so what this does, it breaks it down by body system: neuro, cardiac, respiratory, GI, GU, musculoskeletal, everything. And it also helps you organize all that in exactly the way that you need to be giving it off in handoff report. One of the most frustrating things as a nurse and as a new nurse is giving and getting report, okay? And so this is gonna make that easier for you. Then we also have our drug cards. So I made a lot of drug cards in nursing school and had a really hard time finding anything that really worked well. So this is my answer to that. On here you get 4 different drug cards, and they're designed to help you extract what you need to know, okay? We know the Davis drug guide is a couple thousand pages, so this helps you extract exactly what you need to know about these medications. You're gonna get 5 of these as well, and then you can also make copies. These are paper, and they're designed for you to be able to make copies. The last template you're gonna get is going to be the ultimate clinical brain sheet. Again, this was my answer to Googling for days and weeks and months to try to find a good clinical brain sheet that worked for me. This one breaks it down exactly the way that works in my brain. And if you're a member of our NRSNG community, I'm guessing this is the way your brain works too. So it's organized with assessment notes where you can draw pictures and diagrams of scars or pressure ulcers, medications and times, vital signs, normal lab values, pain scores, and things that you want to research for future clinical reference. And I really like that box there because it makes you focus on things that you need to improve on. So you get 5 of these as well. Then you're gonna get your nice little RN sticker. This is a sticker you can place on your car, on your books, wherever, just to show your pride that you are a nurse. Lastly, you're gonna get a little note from me. And on this note also, you're gonna get some coupons for different products and stuff. And that's just kind of my way of saying thank you. So this is kind of what the introduction to the nursing student toolbox is. It's going to help you massively, okay? Each of these cheat sheets, usually if you look on Amazon, different cheat sheets and stuff, most of these cheat sheets usually sell for about $5 or $6, and these lab value cards for about $3. You get this whole thing together, and you're gonna be able to save a ton of money. Not only that, but more importantly, you're gonna save on the stress and the headache, and you're gonna get yourself to a point that you understand what's going on with your patient, all right? So I hope that helps you guys, and we'll see you soon.